Hi, this is Dr. Charmaine Herman here for another edition of Cultural Competence 102 for the chiropractors. First, I want to thank ChiroSecure for taking the time to make this type of programming available to all of us doctors of chiropractic, and I thank you so much for joining me today. So let's go to the slides. Again, I'm Dr. Charmaine Herman, and this is, again, a series I've been working with ChiroSecure. I'm talking about cultural competence. I am a licensed chiropractor in Atlanta, Georgia, practicing for the past 10 years in Alpharetta, Georgia. I'm also a faculty member at Life University, where I've been teaching for about 13 years. I've been educated for about 20 years. So it's exciting to be able to give back to our community so many of the things that I've learned as an instructor. So let's go ahead. And today's goals are to actually look at the African American, I'm sorry, today's the Latin American community, so our Hispanic and Latino communities, and look at things such as health disparities. We've been talking about health disparities for African Americans in the last episode. So what should chiropractors know about health disparities in the Hispanic or Latin community? So we're going to talk about some of that information. Maybe a little boring because statistics normally are, but it's things that we should know as we try to serve our diverse communities. So the Latin American community, when we talk about health disparities, we're looking at those things that are prevalent, those health issues, those concerns that are prevalent in the Hispanic or Latino community, conditions that are just in, and also things such as health equity and their access to care. So we're going to discuss these types of things when we talk about health disparities for these few minutes. So health disparities are usually people that have issues based upon certain types of um, adversely affected situations they've experienced throughout their lives, whether due to their race, ethnic group, religion, socioeconomic status, gender, sexuality, um, gender identity, things like that tend to actually alienate or marginalize people into areas um, of diversity of I'm sorry of disparities because of how the community in itself has treated people in these various categories. Poverty is a big reason why we see a lot of health disparities, as well as lack of education, understanding how the health system works or how people need to take care of themselves. Homelessness, we see that a lot in our country, and these can be contributing factors to health disparities. There are also non-biological factors of health disparities, such as gender. When we talk about health disparity, those non-biological factors can be socioeconomic status, gender. So many women suffer from abuse from various, whether males and other females. So some things cause non-biological health disparities that are not related to their biology, but related more to the situations that they find themselves in. So we, as doctors of chiropractic who want to serve diverse communities, should definitely be aware of health disparities in order to monitor them in our patients, because we may see them more often than others if they have pre-existing conditions when they come into your practice. I know I have some patients who have things like diabetes and hypertension, and I'll ask them if they're taking their medication, how how they're feeling, how they're doing. I have one patient that was experiencing dizziness after changing her brand of metformin. The pharmacy changed it and didn't let her know, and she started experiencing dizziness. And I told her to inform her health provider what was going on based upon the medication. And recently they changed it back to the brand that she was using. So we see patients more often, and it's good to be able to understand what those pre-existing conditions are and how we can help facilitate their care even better. So, and definitely make referrals when necessary to other providers if we feel that our care is always great, but they may need something else based upon a condition that they're experiencing. So we talk about the Hispanic and Latino community, where we're looking at an ethnic group that consists of people from Cuba, Mexico, Puerto Rico, South and Central America, and other people who have Spanish origin in their history, regardless of their race. This is an ethnic group, so you may have white Hispanics or you may have black Hispanics. So it's regardless of race. In its 2019 census, it was determined that our Hispanic and Latin community were about 60.5 million Hispanics living in the United States. Their population is about 18.4% of the United States population, and they are the largest minority or ethnic group in our country at this present time. 2019, the cities where you found, or states where you found more people who are Hispanic or Latino were California, Texas, Florida, as well as Arizona, New Mexico, New Jersey, Colorado, and Georgia. In 2019, it was noted that 30% of Hispanic and Latinos were actually under the age of 18, compared to 18% of our non-white population. So that means they're growing. I mean, they're still young people, they're going to still grow, and they're going to have children. So this is our largest and fastest growing minority group in this country. Um, Language and literacy among Hispanics tends to be an important issue. Understanding our Hispanic community, whether we have someone in our office that can speak the language or our documents are translated into their language, is important for people to feel comfortable in our practices. So language literacy is really important when dealing with Hispanics and Latino Americans. According to the census, the majority of Hispanics do not, who reside in the United States are in the mainland United States. 71% of Hispanics speak a language other than English at home. 70% are are Mexican, 58.9% are Puerto Rican, 77.7% Cuban, and 86.2% are Central American. So roughly 28.4% of Hispanics are not fluent in English. But I do want to clarify, just because people speak a different language at home does not mean that they're illiterate. Many of them read Spanish very well. So even if we decide to translate our documents into Spanish, they can also read those documents. So that's something to consider in your practice if you're serving Hispanic or Latino um, patients. Is also when we look at economics, and economics is always important because economics drives whether people can have access to healthcare. I think that's really very important as far as their financial situations are concerned. According to our census in 2019, 24.4% of Hispanics compared to 14.5% of non-Hispanic whites worked within service occupations. They also worked 23%, 23.8% also worked in managerial positions and professional occupations compared to 44% of non-white Hispanics. So we see many of our Hispanic population in our in our service occupations, whether they're migrant workers or they're working in our cities and our counties, whether they're cutting trees or working as plumbers. They're more often found in those types of occupation, but that does not mean that we don't have a significant number of Hispanics working in professional occupations as well. As far as their current income, household incomes are at 55,000 compared to 71,000 of non-white households. We also see the unemployment rate for Hispanics is at 5.1% compared to 3.7% compared to our regular populations of non-Hispanic whites. And according to the census, 17.2% of Hispanics in comparison to 9% of non-Hispanics are actually living at the poverty level or below the poverty level in this country. I always think it's a big disservice when we see that people in our country, this most wonderful country in the world, still have so many people living at or below the poverty level. So that does affect us when we're dealing with pricing and how we're going to take care of our patients, what we're going to charge. All of those things are important to take that in account when we start seeing Hispanic and Latino patients. As far as insurance, I mean, right now we have public insurance, but it's apparent in our data that Hispanics have the highest rates of uninsured in the United States. They're the highest racial and ethnic group of being uninsured in our country. Despite of the fact that insurance is quote unquote more accessible today, whether it's because cultural differences, language, many Hispanics do not obtain um, insurance. So you may think about how am I going to treat them if they don't have insurance? Well, again, in my practice, I do see people I'm not on anyone's I'm not a provider under any insurance, so I do have different rates for patients who don't have insurance. Because some people, despite of Affordable Care Act, still don't have insurance, and our Hispanic and Latino patients are some of them. So, as far as life expectancy, as of 2020, the life expectancies for Hispanics were actually at age 82, which is actually great. Women at 84 and men at 79.9 is the average, compared to 80 for our non-Hispanic whites, and 82 for women and 78 for our non-Hispanics. So they're living long, and we want to help so they stay healthy. They are at the risk of many conditions such as cancer, diabetes, asthma. We see a lot of that in the community. Strokes are very common, also common in the community. Also to work in order to get the best care for these individuals. Infant mortality rate is also high. Infant mortality rate tends also to be high. In this population, we see it among Hispanic Americans. The infant mortality rate ranges from 3.8 per 1,000 births. Cuban is as high as 5.6. Cubans are 3.8 and Puerto Ricans are at 5.6 as far as when we talk about the mortality rate of infants. Puerto Ricans are 20% higher infant mortality rate than non-Hispanic whites as far as 2018. So it's really important to pay attention when we get these patients, to get them under prenatal care, adjusting and checking them and making sure they're getting the vitamins that they need. In 2019, Hispanic mothers were 80% more likely to receive late or no prenatal care compared to non-Hispanic whites. So as doctors of chiropractic, we get them in our offices. It's great to have them there, but we also need to help them while they're in our practices as well. So that's going to be an important aspect that we want to pay attention to. Heart disease is still the number one killer in many populations, and it's so in the Latino and Hispanic population. 2018 Hispanics were actually 10% less likely to have a coronary heart disease compared to non-Hispanic whites, which is actually a lower level for that population compared to the mainstream population as we know it today. Hispanic men and women are 30% less likely to die from heart disease, which is um, a great demographic to be in when we see how heart disease is the number one killer of many individuals in the United States. So they are lower in heart disease, as well as adults are also less likely to have a heart attack. But if they do have a heart attack, they may not survive the heart attack. Okay, we was looking at coronary heart disease, or also look at hypertension. So if you look at this chart, it shows that Hispanics are second as far as hypertension to the Black non-Hispanic Black population. They're at 28% for women, it's 23% for men, and we have an overall amount of 27 for the total population of Hispanics and Latinos. So they still have hypertension, but they are not high when they're not as high as other populations, especially non-Hispanic whites, when it comes to coronary heart disease. So we'll look at cancer, which is a big factor in our country, always a concern about that. Between 2014 and 2018, Hispanic men were 20% less likely to be diagnosed with prostate cancer than non-Hispanic white males. Also, Hispanic women were 30% less likely to be diagnosed with breast cancer compared to non-Hispanic whites. Hispanic women and men are twice as likely to be diagnosed with things like stomach cancer and twice as likely to die from stomach cancer. Also, Hispanic women are also 30% more likely to die from cervical cancer. So there are cancers that affect this population and things that we ought to pay attention to, again, when they're in our offices, when we're taking care of them, we're going out and doing screenings. We want to always look out for our patients to see those things that may be prevalent to their population that we can actually make a difference in as doctors of chiropractic. Asthma, I tend to see a lot of asthma patients, and I noticed that our Hispanic, Latino, as well as our Black communities, the children have a higher rate of asthma. In 2018, 2.3 million Hispanics um, were diagnosed and reported as currently having asthma. Puerto Ricans had twice the amount of asthma rates compared to other overall Latinos in 2018, and children tend to die from asthma in this population. So we need to definitely pay attention. We as chiropractors see great results with asthma in our practices from adjusting the thoracic spine. So it's something we need to pay attention to if we are seeing Hispanic and Latino children, especially as well as adults. Obesity among Hispanic Americans, women are 78.8% most likely to be overweight or obese compared to 64% of non-white Hispanic women. 2018, Hispanic Americans were 1.2 times more likely to be obese, as well as suffer from being overweight with issues such as hypertension, such as hyperglucosamia and diabetes. They're at risk, putting them at risk for those types of issues. 2017, Hispanic high school students were 50% more likely to be obese. And when we talk about obesity in our country, we tend to link obesity to people being lazy or not getting enough exercise and having poor diets and things like that. But we also have to pay attention to where our patients come from, the communities that they live in, the foods that they can purchase. I always talk about that the area where we have lack of nutritional foods. Not every grocery store has an organic section, and not every grocery store in every community has the best quality of meats. Some meats are more fatty and things like that. So based upon where our patients are coming from, the communities that they live in, that will also affect whether or not obesity is there. I always tell people if my patients shop at places like Dollar General or the Dollar Tree, places like a Family Dollar, they're not buying healthy foods, they're buying what they can afford. So 10 packs of oodles and noodles and all types of soups, which are high in salt, for $1 is what they can afford at that time. They're not trying not to eat healthy, but they're trying to feed their families. So I think we need to also have more compassion and empathy when we talk about our patients who may be obese or their children on their way to obesity, and have a conversation. Think about things such as community gardens, places that are out maybe outside their communities, even getting a bus to take them to these areas where they can get more healthy food. So it's good to be more proactive as well as healthy and not judgmental with dealing with our patients who may have obesity issues or not be able to have healthy diets. Mental health is always an issue among Hispanic Americans. 70%, among Hispanic Americans, the death rate from suicide is 4 times higher in Hispanic women in 2008. We also see that suicide rate among Hispanics is less than half of compared to non-whites, but we still have issues of suicide within the population. Suicide is the leading cause of death between ages 15 and 34, though, in our younger population, as well as in young girls. We see 30% in the grades 9 through 12 have attempted suicide. So mental health issues usually linked to poverty are things that we should pay attention to with these patients that we see from the Hispanic or Latino community. It's noted that poverty probably causes maybe you see twice the number of suicides or attempts of suicides with people who are in poor situations, which can lead to psychological distress, especially concerns for their families and how they're going to make it through the day. So again, being empathetic and paying attention to the signs are going to be very important for us as doctors of chiropractic when working with patients in this population. So, how do I find out more about the Hispanic or Latino population in my community? Well, definitely go to your website and contact the Minority Office of Minority Health. Their HSS.gov is dedicated to telling us what's going on and looking at the numbers and helping us be better health providers and offering more health equity for our patients. Um, the CDC also has a site just to discuss what we call minority health and health equity, and it's dedicated to getting the information out there to we who are doctors to know how better to serve our communities, maybe volunteering and helping to reach these communities, let them know how chiropractic can help strengthen and encourage and just make them a healthier population overall. So that's it for today. Our next episode will be looking at the Asian and Pacific Islander community, looking at health disparities in those communities and what the chiropractor should know. Thanks again for your time, and thank you again, ChiroSecure, for making this type of programming possible. I really appreciate you, and I hope that you got some information out of these presentation and that you can actually use it in your practice. Thank you.